Okay, I've entered the room and I've washed my hands. I'm here with Adam Staris. The date is July 16th, 2021. Adam Staris is a 24-year-old male born on October 16th, 1996. He is found to be reliable for his own medical history. He presents in the office today for a routine physical examination. He has no health complaints at this time. How would you like to be referred to today?
Adam's fine.
All right, Adam. I'm going to ask you some questions regarding your past medical history, okay? Have you had any childhood illnesses?
No,
Have you had any adult illnesses?
I have not.
Do you currently take any medications over the counter, prescribed, or supplements otherwise?
Just multivitamins.
Okay. Do you have any drug allergies, any environmental sensitivities, any side effects to any drugs that you've taken, or any other allergies?
No.
Okay. Do you use condoms?
Yes, I do.
Okay. Have you ever been exposed to any STIs or STDs?
I have not.
Okay. Do you have any prostate, urinary, or sexual dysfunction?
No,
Okay. So, have you ever had surgery?
I have not.
Have you ever been hospitalized?
Nope.
Have you ever been psychiatrically admitted?
No.
Do you have any psychiatric history such as depression or anxiety?
No.
Okay. Are you up to date with your childhood immunizations?
Yes, I am.
Okay. When was your last flu shot?
I don't get the flu shot.
Okay. What about tetanus shot?
2 months ago.
Okay. Wonderful. Have you ever been screened for any medical conditions such as tuberculosis?
TB screening. That's about it.
Okay. And when was that?
3 months ago.
Okay. So now we're going to talk about your family history.
I don't know my family history. I was adopted.
Okay. You don't know anything about your family?
I do not.
Okay. No worries. So now I'm going to ask you about your social history. Are you currently in a relationship?
Yes, I am.
Okay. Are you in a relationship with a man or a woman?
A woman.
Okay, so what's your sexual orientation?
Heterosexual, so women.
Okay. Do you have any children?
No.
Okay. Where do you currently live?
In an apartment building.
Okay. Do you feel safe at home?
Yes, I do.
All right. Do you work or go to school?
I go to school.
Okay. Do you practice regular safety measures such as wearing a seatbelt when driving a car, a helmet when riding a bike, and wearing sunscreen whenever you go out in the sun?
Yes, I do.
Okay. Do you have a balanced diet?
Yes.
Do you exercise regularly?
Every day.
Do you drink any caffeinated beverages or take any caffeinated supplements?
2 cups a day.
Of coffee?
Yes.
Okay, wonderful. Do you consume any alcohol, tobacco, or any illicit drugs?
Only socially alcohol on the weekends.
Okay, about how many drinks on the weekend?
I would say 3.
Okay, the whole weekend, both days?
Per day.
Per day? Okay, all right. So, are you spiritual at all? Do you identify with any religion?
I'm Catholic, but not really that spiritual.
Okay, gotcha. Here at Advent Health, we do learn an aspect of spirituality with healthcare. So can I offer you any spiritual guidance or assistance at this time?
I'm good for now, thank you.
Okay, no problem. So now I'm going to ask you a series of medical conditions. I want you to go ahead and let me know if you have had or if you currently have any of these conditions. I'm going to go through them pretty quickly, so just stop me if you notice anything that you have, okay?
Okay.
All right. So I'm going to start with your weight. Are you your usual weight?
Yes, I am.
Okay. Have you seen any recent weight changes? Your clothes fitting any tighter or looser? Do you have any fever, fatigue? Have you seen any changes to your sleep pattern, such as insomnia?
Nope, nothing.
Okay. Now we're going to talk about your skin. Do you have any rashes, lesions, lumps, or sores on your body? Any itchiness or dryness? Have you seen any color change on your skin? Have you seen any changes in your hair or nails, or the change in any color or shape of any moles on your body?
Not that I have noticed, no.
Okay, so now we're going to talk about your head. Do you have any headaches? Have you ever had any head injuries, any lightheadedness, or any dizziness?
Nope, none.
All right, so now we're going to talk about your eyes. Do you know what your vision is?
2020, both eyes.
Okay, and when was the last time your vision was tested?
4 years ago.
Okay, and that was the result?
Correct.
Okay, do you wear currently glasses or contact lenses?
None of those.
Okay. Do you have any itchiness, any redness or pain in your eyes?
Nope.
Okay, are you having any excessive tearing, any blurred vision? Are you seeing any spots, specks, or flashing lights?
No, I do not.
All right, have you ever been diagnosed with glaucoma or cataracts?
No.
Okay, so now we're going to talk about your hearing. Have you seen any changes to your hearing?
No, I have not.
Okay, do you have any ringing in the ears, which is classified as tinnitus, or do you feel like the room is spinning or you're spinning around?
No.
Okay, have you had any ear infections, any earaches, or any discharge from your ears?
Mm-mm.
Okay, do you wear hearing aids?
I do not.
Alright, so now we're gonna talk about your nose and your sinuses. Do you have frequent colds, any nasal stuffiness, discharge from your nose, any itchiness in your nose? Do you have any nosebleeds at all?
No.
Okay. Do you have any sinus trouble?
No, I do not.
Okay, wonderful. So now we're gonna talk about your mouth. Oh, do you have any hay fever, any seasonal allergies?
No.
Okay, so now we're gonna talk about your mouth and your tongue. Do you have you seen any changes to the condition of your gums?
No.
Alright, when was your last dental examination?
6 months ago.
Okay, and what were the results?
Perfectly healthy, no cavities.
Okay, wonderful. Have you had any bleeding from your gums?
No bleeding.
Have you had any sore tongue, any sore throat, dry mouth, or any hoarseness?
No.
Okay. No dry mouth?
No dry mouth.
Okay. Have you had any, now we're gonna talk about your neck. Have you had any swollen glands, any lumps, or any goiters or any masses in your neck?
Not that I've noticed, no.
Have you had any pain or stiffness in your neck?
No.
Okay, so now we're gonna talk about your breasts and in this area going all the way over to your armpit. Have you had any lumps? Have you had any pain or discomfort at all?
No.
Have you had any discharge from your nipples?
No.
Okay. Do you regularly practice breast self-examination?
Yes, I do.
All right, about how often?
Once a week during the shower.
Okay, good. So now we're gonna talk about your breathing and your respirations. Have you had any cough? Have you had any mucus that you've been producing?
No.
Have you been coughing up any blood at all?
No, I have not.
Have you had any shortness of breath?
Nope.
Okay. Have you had any wheezing or any asthma?
No, I have not.
Have you ever been diagnosed with bronchitis, emphysema, pneumonia, tuberculosis, or pleurisy?
Mm-mm.
Okay, have you ever had a chest x-ray?
No.
Okay. So now we're gonna talk about your heart. Have you ever had any heart failure?
No, I have not.
Okay. Have you ever had high blood pressure or rheumatic fever?
No.
Okay. Have you ever had any heart murmur, any chest pain, any palpitations, or any shortness of breath?
Nope.
Okay. Have you ever had to use pillows to help you sleep at night?
I do not need to know.
Okay. How about have you woken up in the middle of the night suddenly sitting up and gasping for air at all?
I have not.
Okay. Have you had any edema or swelling in your hands, ankles, legs, or feet?
No.
Okay. Have you ever had any heart tests such as an EKG or anything like that?
EKG when I was younger.
Okay. About when was that?
6 years ago. Perfectly normal.
Okay. Wonderful. So now we're going to talk about your bowels and your gastrointestinal system. Have you had any trouble swallowing?
No.
Okay. Have you had any heartburn?
No.
Have you had any changes in your appetite?
I have not.
Have you had any vomiting or any vomiting of any blood?
Mm-mm.
Have you had any regurgitation?
Nope.
Okay. Have you had any indigestion?
Mm-mm.
What's the frequency of your bowel movements?
Once a day.
Okay, and what's the rough size and color of your bowel movements?
Brown, solid.
Okay. Have you seen any changes recently to your bowel movements?
I have not.
Have you had any pain when going number 2?
No.
All right. Have you had any bleeding from your bottom or any black tarry stools?
No.
Okay. Have you had any constipation, any hemorrhoids, any abdominal pain, or any diarrhea?
No.
Okay. Have you had any food intolerance?
No.
Have you had any excessive belching or passing of gas? Have you had any conditions involving your liver or gallbladder? Have you had any yelling of your skin or your eyes at all?
Mm-mm.
Have you ever had hepatitis?
No.
Okay. So now we're going to talk about your urination. How frequently do you urinate?
About 10 times a day.
Okay. Have you seen yourself producing large amounts of very clear urine at all?
No.
Okay. Do you have to use the bathroom during the night?
Only once in a while.
Okay, every once in a while?
Yeah.
Have you ever had the sudden urge to run to the bathroom and have to urinate?
No.
Okay. Have you had any pain or any burning sensation on urination?
I have not.
Okay. Have you ever had any blood in your urine?
No.
Okay. Have you ever had a urinary tract infection?
No.
Have you ever had kidney stones or any kidney or flank pain?
I have not.
Okay. Have you ever had any renal or colic, which would be an intense sharp pain due to kidney stones at all?
No.
Okay. Have you ever had any pain below your belly button? This would
Mm-mm.
be suprapubic pain. Have you ever had any incontinence, any trouble controlling when you use the bathroom?
Nope.
Okay, have you ever had any hesitancy when you're going to use the bathroom? Any dribbling or any urinary retention?
No.
Okay. So now we're gonna talk about your genitals. So we'll start with, have you ever had any hernias?
I have not.
Okay, how about your penis? Have you had any discharge, any penile discharge?
No.
Any lesions or masses on your penis?
No.
Have you had any masses or pain in your testicles at all?
No.
Okay. Have you ever been exposed to any STIs or HIV?
No.
Do you take necessary precautions to prevent the spread of HIV and STIs?
Yes, I do.
Okay, wonderful. Have you had, what's your sexual function, your sexual orientation, and your sexual habits?
Heterosexual, females, just in general, normal,
Okay. Do you use condoms when you practice intercourse?
every time.
Okay, wonderful. Great, so now we're gonna talk about your peripheral vascular system. This is basically your arms and your legs. Have you ever had any sharp pain that debilitates you when walking? So you can only walk short distances and then you have to stop and rest at all?
No,
Okay. Have you had any leg cramping?
I have not.
Have you had any varicose veins or any clots in your veins?
No.
Okay. Have you had any swelling with redness or tenderness?
No.
Have you had any edema or any swelling in your hands, ankles, calves, or feet?
No.
Okay. Have you seen any changes in the color of your fingertips or your toes during cold weather?
I have not.
Okay. Now we're going to talk about your muscles. Have you had any muscle or joint pain?
No.
Any gout, any arthritis or stiffness?
Nope.
Any backache?
No backache.
Good. So now we're going to talk about your neurologic system. Have you seen any changes to your mood? Any changes to your attention span or your speech?
Nope.
Have you had any changes to your orientation, your judgment, your memory, or your insight?
No.
Have you had any headaches, any vertigo where you feel like the room's spinning, any dizziness, any fainting or blackouts?
No.
Have you had any weakness or paralysis, any loss of sensation or numbness? Have you had any tingling or pins and needles feeling over your body?
No, I have not.
Have you had any tremors or any involuntary movements?
No.
Okay. Now we're going to talk about your psychiatric history. Have you had any nervousness or tension?
No.
Have you had any changes in your mood, such as anxiety or depression? Any changes to your memory at all?
No.
Okay. Have you had any suicidal thoughts or ideations at all?
I have not.
Okay. Have you had any suicidal attempts?
No.
Okay. Have you ever participated in any counseling, any psychotherapy, or anything like that?
No.
Okay. Have you ever been psychiatrically admitted?
No.
Okay. Now we're going to talk about your blood. Do you have anemia?
I do not.
Okay. Do you bruise or bleed easily at all?
No.
Have you ever had any blood transfusions or any reactions to any blood transfusions?
Nope.
Okay. So now we're going to talk about your endocrine system or your glands. Have you had any thyroid trouble?
I have not.
Have you had any heat or cold intolerance?
No.
Or excessive sweating?
Mm-mm.
Do you have diabetes?
I do not.
Have you had any excessive thirst or any excessive hunger?
No.
Have you produced any excessive amounts of dilute urine, just a urine that's very clear in very large amounts?
No.
Okay. Have you had any changes to your hat, glove, or shoe size?
No.
Okay. Thank you.